Oh, great. Okay. Thank you for your invitation to join me this afternoon. I'll be talking about the work that the College of Paramedics has done to incorporate values-based practice into the undergraduate curriculum. Next slide, please. But as you'll know, as a consequence of the large-scale failings of the Mid-Staff Hospital Trust highlighted in Francis' inquiry, the NHS adopted a series of values, and these foundational values of healthcare were enforced into the UK paramedic undergraduate curriculum to ensure that paramedics that produce them could enter the workforce on completion. By coincidence, and at a time I was a student at Catherine's Collaboration Centre, that made me realise that to enter truly into the conversation where patients are discussed and listened to, the clinician needs to be able to understand their value standpoint. This is actually a topic of my postgraduate master's dissertation, and I presented my findings to the Education Advisory Group within the paramedic professional body, the College of Paramedics. Next slide, please. So in 2019, members of the Education Advisory Committee and the Forum for Higher Education and Paramedic Science and student paramedics attended a values-based practice workshop to learn more and develop the place of values in the paramedic curriculum. And this was supported by Professor Bill Fulford and Associate Professor Ashok Kanda. And the group were able to consider the role of values-based practice and how it would be added into the undergraduate curriculum. Next slide, please. And what we've done, we include our output in the next edition of the UK Paramedic Curriculum Guidance, and that was actually published last year. And our overall aim was to ensure that paramedics continue to give the best care to each patient and highlight the role of values in patient care. Next slide, please. So to incorporate it into the curriculum, we worked with the Collaboration Centre to produce a values toolkit, recognising that values-based practice would largely be quite a new consideration for paramedic educators. And the purpose of this toolkit is to augment the teaching of values-based practice in paramedic education as an adjunct to the current undergraduate curriculum. So we have a slide set, a handbook, case studies, and a document for take-home tweaks as well. Next slide, please. As of November this year, 93 out of 104 higher education institutions delivering paramedic education have implemented the toolkit into their teaching. And one of the successes for this uptake is the paramedic focus of the toolkit we produce. So case studies are specific to the profession, noting that paramedics work in a range of clinical settings, not just the ambulance service, and that helps demonstrate its relevance. In creating the toolkit, we produce materials for the lecturers to deliver, which I'm sure anyone who works in education will consider a bonus, and I think that's what really improved that uptake. Next slide, please. So I have to say a really big thank you to the Collaboration Centre for hosting us and helping us incorporate this into our curriculum. Now, when I talk of values and practice, other paramedics understand concerns and understand the viewpoint, and values are really considered in the decision-making approach for patient care, and this work is ensuring the profession continues to give care to the highest standard for the new generations of paramedics that come through. Thank you.